This is Heart Rhythm TV, and I am Julie Shea here with another episode of Advancing Allies. We are here live at HRX 2024, and we just came off a roundtable discussion on insider strategies for remote monitoring. And with me here, I have a moderator, Dr. Martha Ferrara, who is a nurse practitioner at White Plains Hospital, and Rebecca Yapejian, who is an associate manager of device operations for cardiac RMS. So thank you, ladies, for joining me today.
Thank you for having us.
So we had an amazing discussion. I mean, we covered so many things during our 45 minutes there, talking about maintaining tequity, cybersecurity, connectivity, efficiencies, alert managements, clinic workflows. And, you know, I think one of the things, Martha, that you brought up was the culture of remote monitoring. That really is a team effort to kind of make sure that our patients are getting optimized care. So you work, Rebecca, for a third-party vendor for cardiac RMS, and Martha, you use a third-party vendor at your institution.
I do, cardiac rhythm management.
Cardiac rhythm management. Okay, so let's talk a little bit about workflows and how third-party vendors can help to streamline this workflow. So let's talk a little bit about connectivity, because that's one of the biggest things as clinicians that we struggle with remote monitoring, and that was one of the big things that came out of the 2023 guidelines was connectivity. So from your side, Martha, let's talk a little bit about connectivity and why that's important to you as a clinician.
So the connectivity rate is sort of like a marker for the health of your remote monitoring clinic. And I think that when you use a third-party remote monitoring team, that they are absolutely on board with the fact that your connectivity rate will indicate the health of the clinic, but also the work that they're doing in connecting patients. And it's from a perspective of patient safety. So a connectivity rate for me that is 95% and above represents a lot of the work that we put into remote monitoring, connecting patients, but also keeping our patient safety standards high.
Right, excellent. And Rebecca, from the third-party vendor side, can you address that a little bit?
Absolutely. So it is a team. That's the whole point. And when we bring new people on, one of the biggest things that we stress is our number one goal is patient care. We are there to be patient care advocates just as much as our clinicians are. And so we actually have a patient engagement team to help offload a lot of the administrative work that we have clinicians doing. Calling patients to tell them to plug in a box or to re-engage their Bluetooth or whatever they're using is not the work of a clinician. That's administrative work. And so we take that burden off so that our clinicians can see the patients they need to see. They can do the work they need to do, they were trained to do, and work to the top of their scope just as much as they want to be working to the top of their scope.
And that's the culture of a remote monitoring clinic. Right. It is a team effort. Yep. The rhythm management group team that I have absolutely engages with our patients, with the way that we want to set up our patient follow-ups, our alert management, and it is a culture that you live together. And as long as everyone is focusing on the fact that patient care is what we're looking for to be the lighthouse, so to speak, that is the guiding light that we all have. So it doesn't seem that it would be a successful team unless you are all on board, as Rebecca is saying, because they are there to help us do the work that we are doing. It's very rewarding when a third-party vendor can engage that way in remote monitoring.
Yeah, absolutely. And, connectivity is so important because it truly is the underpinning of remote monitoring, right? If your patient's not connected to remote monitoring, then they're not getting the care that they need. So super important. And what about, the other big kind of pain point that I think most clinics deal with is alert management. So from your point, with your system that you use, how is alert management handled at your institution?
So what we do is we have frequent meetings, and we all sat at the table some of them virtually, but we all sat at the table and we just outlined what you would classify as your priority alerts. And I know we all speak the same language in remote monitoring. We have our red alerts. Those need to be immediately addressed. And I would say setting the parameters, like what constitutes a red alert for a pause, a red alert for ventricular arrhythmias, a red alert for, a patient not anticoagulated who has AF. So it isn't a robotic manner of doing alert management. It's absolutely patient engagement from that patient clinical's perspective. And that's not easy to do because you follow thousands of patients.
Right.
So your alert manager is your clinician, the clinician that will oversee who is deemed urgent and who is deemed that will be the second tier of patients to call.
To get the actionable events in and
Exactly.
taken care of. So Rebecca, from cardiac RMS perspective, can you talk a little bit about how you help the clinical team with alerts?
Absolutely. So one of the things I stress to my team, so I'm an EP nurse practitioner as well, so I've experienced that Martha's pain from a clinician's standpoint. And so I encourage my team on a regular basis. If you're seeing the same patient's name pop up, reach out to the clinic, ask if we can make some changes to alerts management, right? So do we need to see every single episode of somebody with paroxysmal AFib who's anticoagulated, or do we only want to see the ones that last X amount of time or with a rate at a certain level? So that's one of the ways that we do it. But we also have formed a alerts management team and a protocol that we are sending to our clinics to get permission in advance to make those changes, so we don't have to bug you with the questions.
Yeah.
We don't have to send you a message, Martha, and ask permission because you gave us that permission. And then if you have an exception to the rule, you send us a message, and we make a note in that patient that this patient, no, do not change those alerts or change the alert to something different. But we actually have formed an entire team focused just on alerts management because of the 2023 consensus statement that made remote monitoring the standard of care.
Yep.
Now we absolutely have to streamline it because just as much as clinicians can burn out from seeing too many alerts, my team can burn out from seeing too many alerts too. So we don't want the third-party vendors burning out. Otherwise, then we don't have that. Then we don't have third-party vendors anymore. So
and that's the culture, Rebecca, right?
Yes.
That's the culture.
Right, exactly. So, it underpins the importance of streamlining workflows and working together. I love this, kind of industry partnering with clinicians to really provide the best care for our patients. So thank you so much. That was a great session, so much information, great discussions, and I appreciate you joining me today. So thank you so much.
For having
Thanks
us.
This is
for inviting
Julie
us.
Shea for Heart Rhythm TV.